kind of calm. I'm going to take a look at your scalp and check your ears to see if we need to do any cleaning. First, I'm just going to slowly palpate, looking for any nodules or signs of inflammation around the earlobe. Color looks normal. Not seeing any lumps. Maybe just one, or very little right here. Seems to be harmless. Noticing a little bit of debris in one of the earring holes. We can definitely clean that. First, I'm going to just slowly touch it and try to clean the skin. This spray has antiseptic properties. It helps to reduce bacteria. Now I'm applying a cleansing foam, so it's going to feel a little bit wet. We're just cleaning the skin to make sure that there is no debris. That's very good. Just breathe through. Take deep breaths in. That usually helps. Okay. And now we're going to clean the left ear as well. First, I'm going to use antiseptic solution. It neutralizes bacteria. It has also antiviral properties, mint and eucalyptus. Okay, that's lovely. Now we're going to use the same cleanser. It's going to feel very foamy and a little bit wet. go ahead and check your scalp next. Looking at hairline. Noticing a little bit of alopecia on the side, which can happen after a certain age, and it seems like it's not very advanced. What we could do is to prescribe some medicated oil that helps with hair growth and regeneration. I'm not seeing any redness going towards the right side of your scalp. I'm going to use a wooden spatula to better inspect the scalp texture. Scalp is definitely on the healthy side. I'm not seeing any signs of vitamin deficiency. But the hair definitely breaks easily, so it's prone to damage. you usually wear your hair in a ponytail?
No, but I used to when I was a kid.
I definitely don't recommend wearing it in a ponytail, at least not a very tight one. That usually damages the hair even more and puts a lot of mechanical strain on it. Have you noticed any itchiness on the right side, right above your ear? Okay. I'm gonna have you flip over and I'm going to take a look at the base of your skull.
Okay.
Okay, so first I'm just going to brush the hair towards me. Then I'm going to take a look at the scalp. I'm gonna look for any lumps or bumps or scars. Okay, definitely noticing a white spot. Seems like it's also a little bit of alopecia. It's right on the right side of your scalp. But so far I'm not seeing any redness. It does seem to have a stronger texture towards the hairline. I'm going to do a few tests here to check the skin integrity since there is a little bit of rosiness, and I just want to make sure that there is no eczema. Okay. We can apply an anti-inflammatory oil. It's going to help to stimulate blood flow in this area. It has vitamin D infused properties. And we're applying the oil directly at the scalp and base of the hair to make sure that it is easily absorbed through the dermis. You're going to feel kind of like a warm, fuzzy sensation. That's going to be localized just where we applied the oil. Okay, I like the texture now. Noticing one small raised papule. It doesn't seem to be infected. Usually we would be worried about a cluster of them, but since it's just one, I'm going to keep an eye on it. A small spider angioma. Noticing one more. They seem to be small in size, circular. There's no need to do any tests. Okay, I would like to do on this side a massage to help stimulate blood flow. You're going to feel small pulsations. This helps to adjust the cranium and bring balance to the bone structure. It also helps with spine realignment and to fix cervical neck posture. Going to apply pressure point therapy on the occipital lobes. Going to work on the lymphatic drainage as well. I'm going to apply a little bit of oil here on the neck muscles. I'm going to apply some acupressure therapy. This will help to relieve the inflammation at the base of the skull. Let me know if it hurts, okay? I'm not seeing any edema, which is a good sign of lymphatic drainage that is functioning properly. Okay, we're finalizing the treatment for today, and on your own time, I'm gonna let you open your eyes and you can take a deep breath in to allow for oxygenation to enter your whole body. Hi, Kate.
Hi,
How are you?
I'm doing okay. How are you doing?
I'm good. Thanks for asking. My name is Dr. Matt. I'm going to do your exam today. Let's go ahead and verify your first and last name and your date of birth.
Great. It's Kate C. ASMR, March 10th, 1997.
Okay, perfect. When was your last physical?
Around a year ago.
Okay, I'm going to ask you some questions to make sure that I have your medical records in order. Do you have any allergies?
I don't.
Okay. Okay, any medications that you're taking on a daily basis?
Just my birth control.
For how long have you been that?
Around like 15 years.
Okay. And when was your last gynae exam?
Like 6 months ago.
Okay. Any surgeries?
No.
Any injuries? Any broken bones?
No.
Are you experiencing any pain right now?
No.
Okay. Do you wear contacts?
No.
Okay. When was your last vision check?
Around 6 months ago.
Okay. Any family history of heart disease?
No.
Okay. What we're going to do today, I'll take your vital signs and then I'll do a full body exam to make sure that everything looks good. This is what we have to do annually.
Okay.
And I'll have you change an account so that we can start taking your vitals.
Okay.
All right, I'll step outside. I'm going to go ahead and put gloves on. We'll take your vital signs. Have you noticed any fever like symptoms?
No.
Okay, I'll take your blood pressure first. This will go on the upper side of your right arm. Go ahead and uncross your legs for me, please. Blood pressure is within normal limits. This will go on your index finger. Did you have anything to drink, hot or cold, before coming in?
I had some cold water.
Okay, we'll put this under your tongue. Go ahead and hold it with your right hand. Perfect. My pressure was 120/70. Heart rate is 82 resting. And oxygenation is 98% on room air. Let's go ahead and check that. Oops, sorry. 96.2 Fahrenheit. Okay. We have all the vital signs. I'm gonna ask you to lay down and we'll start by examining your head and your face.
Sounds good.
Okay, Kate. I'm just going to start by palpating your submental lymph nodes using a circular motion to determine if there's any inflammation. Moving back to the postauricular lymph nodes. And preauricular lymph nodes. Palpating sinuses right under your eyes, lateral to the nose of the bridge. And above the eyebrows. Okay. Can you please tell me if you feel this equally on both sides?
Yes. Yes. Yes.
Okay. Go ahead and tell me if you feel this on the left or right.
Right. Left. Left. Right. Right. Left. Left. Left.
Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Cold. Warm.
Just taking some measurements that we have to make sure we have in your file. One of them being head circumference. So go ahead and lift your head up when you're ready. Place it back down. Good. Lift it back up. Thank you. Okay, can you go ahead and open your eyes? Very good. And now, can you cover your right eye for me?
Yes.
Okay, so I have here some cards. Are you able to see them?
Yeah.
Alright, can you please identify what you see in the card?
An eye.
And what color is this?
Pink.
Okay. What about this? What is it?
A leaf.
And what color is the card?
Purple.
Okay. What about this? What is it?
A caterpillar.
And what color is the card?
Orange.
Very good. Go ahead and switch eyes. Can you identify this object?
A shrimp.
And what color is the card?
Yellow.
Okay. What color is the card?
Blue.
And what do you see here?
An octopus.
Very good. One last one. What color is this?
Purple.
And what do you see here?
A giraffe.
Very good. And that looks normal. You can go ahead and relax your eyes. Do you feel the vibration?
Yes.
Tell me when it stops.
No.
Do you feel this?
Yes.
Tell me when it stops.
No.
Okay. Checking your hearing one more time. Go ahead and tell me which position here is louder. Position number 1 or 2.
2.
Position 1 or 2?
2.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. 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 No.
Excellent. Okay. Now we're going to check your facial sensation for painful stimulus and dull stimulus. I'm going to touch you with a sharp object. This is what sharp is going to feel like. And then a dull, soft object. Now go ahead and tell me if you feel sharp or dull.
Okay. Sharp. Dull. Sharp. And that one was hard to tell. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Okay, perfect. Now I'm going to touch you with a different surface on the face. I'm going to need you to tell me if you feel it on the left or right.
Okay. Right. Right. Left. Left. Center. Right. Left.
Okay, let's go ahead and check your scalp next. Have you noticed any type of itchiness or redness?
No.
Okay. Do need a little bit of light. We do need a little bit of light. So let's see what we have here. Not seeing any redness, which is a good sign. But I do want to make sure that there is no vitamin deficiency. Sometimes we would see it in the scalp if patients have vitamin B12 deficiency. feel this cold or warm?
Warm.
And does this feel sharp or dull?
Sharp.
And does this feel sharp all the way?
Yes.
And does this feel sharp?
No.
Okay. That's good. Seeing a little bit of redness. Have you noticed some itchiness around the top of the scalp?
A tiny bit.
Just look like they're papules and they're clustered. So I'm going to go ahead and take a sample. First, we're going to apply a basing serum. It helps to lower the acidity so that we can collect the sample properly. We do have to take 2 samples. Okay. Very good. Have you noticed any changes in your smell?
No.
Okay. Go ahead and try to take a deep breath in and tell me what this smells like.
Orange. Mint.
Okay, go ahead and give me a big ah. Gingiva is a little bit red. Not sure what's going on there. Maybe your body is just fighting an infection. Let's go ahead and check your ears. Tympanic membrane is broke, right? A little bit of redness here too, so that could explain. Okay, very beautiful. Looks good. Alright, I'm gonna have you look up towards the ceiling for me. Try to keep your eyes open. Not seeing any redness there. Optic nerve is a little bit inflamed on the right side. Okay, let's go on and check your heart now. Is it okay if I put the stethoscope under the gown?
Yes.
Heart rhythm is normal, so normal sinus rhythm. I'm not hearing any skipped beats. Let's go ahead and check for murmurs. I can hear only S1 and S2. No S3, no S4. You go ahead and take a deep breath in and exhale. And again, breathe in and exhale. Okay, bilateral lung sounds are clear. Let's go ahead and first listen to your abdomen. It's going to feel a little bit cold. Okay. Progressing in all four quadrants. And now I will do a gentle light palpation first. Looking for anything swollen. Let me know if you feel any type of tenderness as I'm doing this. And now I'll do a deeper palpation as well. let's go ahead and check your back now. So I'll have you flip in your tummy.
Okay.
Palpating spine, we're looking for signs of scoliosis. Which is a spine deformity. Sometimes it can happen because of bad posture. Centimeters. We're checking for misalignment and asymmetry. So the right side is a little bit more elevated. It's about 2 centimeters difference. Checking for any abnormal neurological responses. Looking for any pulsations around the spine. Checking for any skin lesions. Any redness, something that would indicate an inflammatory response. It's a very good sign we're not seeing any redness. A little bit of inflammation in the thoracic area. We can order some more tests. Go ahead and take a deep breath in for me. And exhale. And again, breathe in. And exhale. going to check the base of the lungs. Take a deep breath in. And breathe out. Very good. Let's do that one more time. Good. And breathe out. There were some diminished sounds on the left side. So we're going to go ahead and percuss, see if there's any fluid buildup in the alveoli. Have you noticed any kind of cough in the last 2 weeks?
No.
Go ahead and say 99.
99.
Again, 99.
99.
One more time, 99.
99.
And let's go ahead and check for any abnormal sensations. Something like an pinched nerve could definitely trigger that. Can you guys tell me if you feel this sharp or dull?
It's sharp.
What about now?
Just kidding, that one is sharp.
Okay, no problem. What about now?
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
Okay. Excellent. Alright, I think we're done. There are definitely some abnormal results that I'm gonna have to do a little bit more testing. So I was able to hear a murmur, which that indicates we need to get an echocardiogram.
Okay.
And depending on what results we get from there, then we're gonna have to do maybe more testing. Also on the back, let's go ahead and run a CT of the back.
Okay.
And I'm not very concerned, but I just want to cover my bases and make sure that we are ruling out anything that is more serious. And once that is ruled out, we can go ahead and start with a treatment.
I appreciate that. Thank you.
You're welcome. Do you have any questions for me?
Should I be concerned about the heart murmur?
No, no. Sometimes that can be congenital, which means that you were born with it and maybe it wasn't diagnosed. But let's make sure that the echo does look good and we'll go from there.
Okay. Thank you.
You're welcome. I'll see you back in a couple of days. All right, let me know if you have any questions in the meanwhile.
Thank you, doctor.
You're welcome. Hi, Amanda.
Hi.
My name is Dr. Matt. I'm here to do your exam.
Nice to meet you.
Nice to meet you too. Thanks for coming in. Since I don't have medical records for you, can you please state your full name and your date of birth? We're just going to create a new file for you.
It's Amanda Jackson and July 2nd, 2000.
Okay. Do you have any allergies to medications? Okay. And when was your last physical?
About a year ago.
Any concerns that you would like me to address today?
No, just like a yearly routine.
Okay. Are you taking any medications on a daily basis? When was your last gynecology exam?
Last year.
Okay. What about dental?
Like a few months ago.
Okay. Alright. Do you wear contacts?
Yes.
Okay. When was your last eye exam?
Maybe 6 months ago.
And how often does your prescription change?
It doesn't really change that much anymore.
Okay. All right. Have you noticed any bumps or itchiness or eczema on your body?
No.
Okay. And are you experiencing any blurry vision, any peripheral vision loss, double vision? Okay. Have you noticed any changes in your voice?
No.
Any flu-like symptoms?
No.
Okay. Any changes in your muscle tone or balance? Okay. Are you experiencing any pain right now?
No, not really.
Okay. And have you had any surgeries in your lifetime?
Yes, I have.
Okay. What surgeries?
I had surgery on my elbow.
How long ago was that?
Like 15 years ago.
Okay. And which elbow is it?
Left.
Was that from an accident?
Yes.
Okay. Any other injuries?
No.
Okay. How many hours per night do you sleep?
Like 7 to 8.
And is that enough for you to feel rested in the morning?
Yeah.
And what kind of diet do you have?
I'm a vegetarian.
Okay. For how long have you been
10
vegetarian?
years.
Are you taking any supplements?
No.
Okay, we're definitely going to check your B levels. It's very common for vegetarians and vegan people, those who follow a plant-based diet, to have a deficiency in the vitamin B. So we just want to make sure that everything looks good. Do you drink coffee?
No.
And what about alcohol?
No.
And do you smoke?
No.
Perfect. Let's see. Family history. Do you have any family history of heart problems?
No.
All right. I believe I have everything. Let's go ahead and start with your vital signs. I'm going to take your temperature. Have you noticed any flu-like symptoms in the last 48 hours?
No.
All right. 96.4 Fahrenheit. And I'm going to check your blood pressure. Is the left arm okay?
Mm.
All right. Perfect. I'm going to have you relax and uncross your legs. Okay. This will go on your arm. Blood pressure is 110/70, just very normal. I'm going to go ahead and slow this down. Let's go ahead and check your pulses. So I'm going to put 2 fingers on your wrist.
Mm-hmm.
Okay, now I'm just going to go ahead and compare. Good. Strong and symmetric. Temperature was 96.7 Fahrenheit. Respiratory rate is about 16 per minute. Blood pressure 110/70. Heart rate was 75. Alright, perfect. I'm going to start with a vision check. Go ahead and look straight here at my nose. I'm going to flash a light in your eyes. We're looking for pupil dilation. Good. I'm just going to go ahead and lower your eyelid and take a look and see if there is any yellowish discoloration. Okay. I'm going to have you close your eyes and I'm going to try to open them. Don't let me do that. Good. Now go ahead and lift your eyebrows. I'm going to try to push them down. Don't let me do that. Okay, perfect. Now go ahead and look right here. Alright. Now look here. Okay. Go ahead and give me a big not seeing any redness. Tongue looks pink and symmetric. Go ahead and give me a big smile. Good, so that's symmetric. And now frown for me. Alright, and puff your cheeks. Keep them puffed for me, don't let me unpuff them. Alright, relax. A little bit of asymmetry there on the right side. We're going to check your muscles there too in just a second. Let's go ahead and check your nose now. Okay, I'm going to have you look up. So we're looking for obstruction. Okay, that looks good. That looks normal. Let's go ahead and check your ears as well. I'm going to have you look towards your right side and relax. The tympanic membrane is pro-gray. There is no signs of infection. A little bit of obstruction here. We could definitely go ahead and remove some of that earwax. I'm going to take some measurements. So first we're going to start with head circumference. Good. Going to check the shoulder length. Okay. And just go ahead and extend your arm like this. I'm going to measure your arms. And the other side. Okay. And now check the circumference of your arm. So we're looking to see if there is any asymmetry in between them. Okay, I'm going to check your waist as well. Go ahead and place your arms a little bit to the side. Okay, good. And relax. Okay. Perfect. I'm going to check your reflexes now. So we're going to start with the jaw. I'm going to have you relax your jaw a little bit. So kind of like this. Perfect. Okay, good. Okay. Go ahead and relax your elbow. This is the elbow that you had the accident on. Okay. Good.
Relax.
Okay, relax your arm. Good. Perfect. Okay, wonderful. So I'm gonna have you turn around and I'll take a look at your back now, okay? I'm going to go ahead and put gloves on. And first I'm going to take a look at your back. Now put your hair up in a bun just so that we can take a look at the spine. Sorry. I'm going to start by palpating, looking at the cervical spine. Noticing a little bit of lordosis and the thoracic area. Let me know if you experience any kind of pain as I'm pressing down. And I'm not noticing any other signs of abnormal curvatures. No scoliosis. Doing some measurements on the upper spine. It's going to feel a little bit cold. Slight swelling as I'm moving up the cervical spine. And it diminishes as we're going towards the thoracic area. bit of symmetry between left scapula and right. So I'm going to keep an eye on that and see if it changes in the next 6 months. I'm going to touch you on the right and left side of your spine. Go ahead and tell me if you feel this on the right or left.
Right. Right. Left. Left. Right. Left. Both. 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 Right. Left. The middle. The middle. The middle.
Okay, that was very good. Next, I'm going to draw some shapes and letters that are pretty common. So I need you to tell me if you can distinguish, and we're looking at how well your brain can perceive the stimulus. This is gonna feel a little bit wet, okay?
Mm. The circle. Two. Oh, there's more. A square. An A. I don't know.
Okay.
A V. I don't know.
Okay.
A C. A V.
All right. That looks good. I'm going to go ahead and wipe that. Okay, perfect. Okay, I'm going to go ahead and remove the ponytail. So we're going to take a look at your scalp. Looking for any lice infestation, also eczema, and any skin disorders that we can definitely treat very easily in the office. noticing any signs of parasites, we can go ahead and just take a look at the skin. Okay, I'm gonna have you lay down, and I think that's when I'll be able to take a look better at your skull. I am noticing a little bit of redness. Any increased itchiness or dryness of the scalp that you've noticed?
A little bit, yeah.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Cold. Cold.
And did that change in intensity?
No.
Stay the same, okay. Now go ahead and tell me if you feel this sharp or dull.
Sharp.
And do you feel this sharp all the way?
Yes.
Did that change in intensity?
No.
I'm going to take a sample and we're going to send this to the lab. Since I'm noticing that redness, I just want to make sure that there's nothing concerning. And if there is, we're just going to get a proper treatment and know exactly how to heal it. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
And does this feel cold or warm?
Cold. Warm.
And do you feel this sharp all the way?
Yes.
What about now?
No.
Go ahead and tell me when you don't feel the vibration anymore.
Now. 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 Now.
Okay. palpate your ears first, and then we're going to check for any auditory deficiency. We're checking for mastoiditis, which is the bone right behind your ear. Sometimes the only sign of that type of infection is just some tenderness that is behind on the bone, and there doesn't seem to be any inflammation. Going to slowly palpate your ears. I'm not feeling any nodules, which is good, on both left and right. Go ahead and tell me with which ear you hear the sound.
Right. Left. Both.
Okay. Now go ahead and tell me when you don't hear the sound anymore.
Now. Now.
And tell me which position here is louder, position A or B. So this is position A, and this is B.
B.
And this is position A and B.
A.
Going to slowly palpate your nose and then moving to the sinuses. I'm not feeling any swelling. And there's another set of sinuses right in between the eyebrows, a little bit above. Hairline looks intact. I'm not seeing any signs of alopecia. Checking lymph node placement to see if there is any signs of inflammation. We're looking for any nodules. So we're palpating preauricular lymph nodes and postauricular. Also submental right under the chin. I'm going to check for any TMJ disorders. So I'm going to have you slowly open your mouth as wide as you can and slowly close it as soft as you can. I'm not feeling any clicks there. Normal hair distribution of the eyebrows. Eyelashes also look normal in size. Eyes are symmetric. Not feeling any swelling around it. Good. We're going to go ahead and check your sense of smell. So that's your olfactory nerve. I have here an essential oil smell. Go ahead and try to take a deep breath into your nose and out through your mouth. And see if you can identify that smell.
I don't know what that is.
Okay. I have here a few more so we can definitely make sure that the test is accurate. go ahead and see if you can identify that.
Mint.
Okay, that was close. I do have one more. What about this one?
I don't know what that is.
Let's go ahead and check your taste. I'm going to place a drop of this essence on your tongue. I'm going to have you identify it, okay?
Mm-hmm.
Go ahead and open your mouth. Good.
I don't know what that is.
Okay. We're definitely gonna have to do more tests and see exactly why that is happening. I'm going to go ahead and check your abdomen and skin now, okay?
Mm-hmm.
I'm going to go ahead and listen to your heart. Okay, I can hear only S1 and S2, no S3, no S4. We're listening for any murmurs now. I'm gonna have you take a deep breath in and hold it for 3-4 seconds, okay? And hold it. And breathe out. Okay. Everything looks good. I'm going to listen to your lungs now. I'm going to have you take a deep breath in and exhale. And again, breathe in and exhale. Good. Now I'm going to listen to the sides as well. Breathe in and breathe out. And again, breathe in and breathe out. Okay. I'm going to check the skin on your arms, okay? I'm definitely noticing the scar here on the left elbow. I'm going to lift your arm up a little bit. Okay, I'm going to check the skin. We're looking for any raised bumps. Capillary refill is within 2 seconds. I'm not noticing any splinter hemorrhages. Also, there's no palmar erythema. No signs of vitamin B deficiencies. Just going to go ahead and check for any raised bumps. There's one right here on the right elbow, but it looks normal in size, and I'm not seeing any abnormal discoloration. I'm just going to write that in your file and take a look at it in a few months. Okay, we're going to take a picture of this and save it in your file. Okay. Now we're gonna go ahead and check your legs. Just going to slowly palpate. Let me know if you feel any kind of pain. We're looking for asymmetry and changes in temperature. Checking pedal pulses. Good peripheral circulation. Capillary refill is within 2 seconds. Normal temperature, and I'm not seeing any edema. Okay. Again, we're checking to see if there's any skin moles, lesions that would require attention. There's one right here on your foot. We're going to go ahead and take a picture of that as well. Keep it in your file. Just gonna watch it and see. I'm going to look in between your toes to see if there is any eczema. I'm going to do Lipinski reflex here. Just relax. Good. And one more time on the left side. Good. I'm just going to have you push your pads towards you, okay? Towards you. Towards you. Like so, push your legs. Pull your legs towards you. Perfect. And now push with the pads away from you. Both of them? Okay, good. I'm going to slide my hands under your heels and go ahead and push. Okay, good. Now I'm going to try to push your legs down. I'm going to start with the right leg and don't let me do that, okay? Okay. Now try to other leg. That's perfect. Good. Go ahead and listen to your belly. It's going to feel a little bit cold. You can definitely just breathe normal. Wait for Gus. And slowly I'm going to palpate. Let me know if you feel any kind of pain. Were you feeling some pain here?
No.
Okay. Going to go ahead and have you sit back on the table and we'll talk about the results. Alright, I'm just going to go ahead and take off these gloves. And I took some pictures of a few spots that I thought they were a little bit concerning. Now we have them in your file and we're just going to compare them with 6 months from now. I'm gonna have you come back. Okay, so it's May, kind of like December.
Mm-hmm.
Okay. Perfect. Do you have any questions for me?
No.
All right. Thank you so much for coming in, and I'll see you soon.
Thank you.
Hi, Nicole.
Hi.
My name is Dr. Mad. I'm going to do your cranial nerve exam. Go ahead and tell me your date of birth and your last name.
October 21st, 1998. My last name is Smith.
And what brings you in? Why do you want to do a cranial nerve exam?
I'm having some dizziness. I feel really loopy. And I've had like just weird sensations in my arm and my back. I'm like losing sensation of feeling in those areas, which really bothers me.
Okay. Well, you're definitely young, so that kind of problem is something that we need to take very serious and to investigate a little bit. For how long has this been going on?
About a month and a half, I would say like 6 or 7 weeks.
Have you noticed any loss of taste or smell?
No.
Are you taking any medications on a daily basis?
No.
Do you have any allergies to medications?
Penicillin.
Are you having any pain?
No pain. No.
And how would you describe the loss of feeling? Do you feel any kind of pins or needles?
Sometimes. It's normally like I'll touch an area and I just won't feel it.
Okay.
It won't register.
Numbness.
Yeah, it's a numbness sensation.
Okay. Have you noticed any blurry vision, double vision, any peripheral vision loss?
No,
Do you wear contacts?
I do.
When was your last eye checkup?
About 10 months ago.
Have you noticed any changes?
Nothing really. No.
Okay. Have you noticed any lumps or bumps anywhere on the body that I should check right away?
No.
Okay. I'm going to go ahead and put gloves on. I'm going to listen to your heart and lungs first. I can hear only S1 and S2, no S3, no S4. I'm going to listen to the bell for any murmurs. Can you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay, good. Breathe in for me and strongly exhale. And again, breathe in and exhale. Okay, no crackles, no wheezing.
Okay.
I'm going to check your pulses as well. 2 plus. Synchronizing. Perfect. I'll take your blood pressure. Is this arm okay?
Mm-hmm.
I'm gonna have you uncross your legs, please. Blood pressure is a little bit elevated, 130/65. I'm going to go ahead and remove this. Let's go ahead and check your temperature. Any flu-like symptoms?
No.
Just do it again because there's a lot of sound. Any flu-like symptoms?
No.
going to put this under your tongue. Go ahead and hold it for me, please. Thank you. We'll measure your oxygenation as well. This will go on your left index finger. Okay, let's go ahead and check that. Thank you.
Thanks.
97.2. That's really normal. Perfect. Alright, so let's see. I'm going to check your reflexes first. I'm going to have you relax your lower jaw. Good. Go ahead and relax your arm for me. So leave all the weight on my hand. Perfect. Good. Okay. Relax. Perfect. Okay. Relax. Okay. Relax. Good. Okay. Alright, and relax your weight. That's great. Okay. Okay, diminish reflexes on both sides. We're gonna have to check your thyroid levels as well to make sure that it's not a hormonal imbalance. Okay. Alright. Let's go ahead and look inside your ears. You're just going to feel the tip of the otoscope inserting. Good. Tympanic membrane is prograde on both sides. We're going to check your optic nerve now. Perfect. So I'm going to have you look behind me straight at the wall. Try to keep your eyes open. Good. Okay. Perfect. I'm not seeing any lesions or anything like that, so that's
Okay.
very good.
Good, good.
I'm going to check your hearing now. Go ahead and tell me when you don't hear the sound anymore.
It's gone.
Go ahead and tell me when you don't hear it anymore.
It's gone.
Now, can you please tell me which position here is louder, position number 1 or 2?
Okay.
So this is 1 and 2.
2 is louder.
This is 1 and 2.
2 is louder.
Okay. I'm going to go behind you, and I'm going to need you to tell me when you don't feel the vibration anymore.
don't feel it. I don't feel it.
Okay. We're going to check your taste now. So I'm going to put one paper on your tongue.
Okay.
Let's see. It's there. Alright, here we go. Go ahead and tell me what this tastes like.
It tastes like a piece of paper.
Okay, so like it doesn't have any taste. Is that what you're saying?
It doesn't have any taste.
Alright. What about this one?
Oh, wow. That is like a very strong flavor.
Okay. Is it sweet, bitter, salty?
Bitter.
Bitter.
Yeah. Oh, not good.
I'm sorry.
It's okay.
Okay. What about this one? Alright, what does that taste like?
Sweet.
Sweet. Let's go ahead and try just one more. This will allow me to understand if there is any nerve damage
Okay.
on the upper spinal cord.
That is sour.
Sour.
Yeah.
Okay, so the results are normal, which is very reassuring. I'm going to go ahead and do a smell test as well. Okay, so first we're going to go ahead and check patency. I'm going to cover one nostril. Breathe in, breathe out. Alright. Breathe in, breathe out. Good. Okay, go ahead and cover one nostril for me. And I'll have you slowly breathe in and slowly breathe out. And what does that taste like for you?
Some, like a tree, like maybe evergreen tree.
Okay. Let's go ahead and switch layers now. Thank you.
That one smells like a pasta sauce.
Okay. And now you can breathe in with both layers.
With both. That one smells like a lemon zest.
Lemon zest. Okay. Everything looks very good. I have no concerns there.
Okay.
We're going to go ahead and lay down now. I will do your upper body sensitivity. I'm going to start by palpating your preauricular lymph nodes. And now I'm palpating postauricular lymph nodes to see if there is any swelling. Submental lymph nodes are right under your chin, so we're going to go ahead and check those as well. I mentioned earlier that we're going to check your thyroid gland, which is situated on the inferior side of your neck, right at the base. Usually it's non-palpable, and I should not be feeling any kind of lumps. Everything looks normal. Okay. Now I'm going to do a sensation test on the face. Can you go ahead and tell me if this feels sharp or dull?
Dull.
What about this one?
Sharp.
Okay, so we're going to continue with this test. Throughout the face, I'm going to touch you with these two textures. Tell me if you feel sharp or dull.
Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp.
Okay. Now go ahead and tell me if you feel this cold or warm.
Cold.
What about now?
Oh, that's cold. That's really cold. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm. Cold.
Okay. Can you please tell me if this changes in intensity?
It stays the same.
And now?
It's the same.
Okay. Everything looks normal here. We're going to go ahead and focus on your scalp now. Go ahead and tell me if this feels cold or warm.
Warm. Cold. 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 Cold.
Okay. And does this feel sharp or dull?
Dull. Dull. Sharp. I can't really feel that. I think it's sharp.
Okay. Does this feel sharp all the way?
I could feel most of it being sharp.
Does this feel Cold or warm?
I can't tell.
Okay. Does this feel dull?
I think it's dull.
Okay. Is this sharp or dull?
Dull.
What about now? What does it feel like?
Sharp.
And is this cold or warm?
I can't tell.
What about now?
Maybe warm? Dull? Dull.
Does this feel cold?
Doesn't really feel like anything.
What about now?
It's the same.
Does this feel cold or warm?
I can't tell.
And here?
Same, I can't tell.
So there's definitely something going on in that spot. I'm just going to do a few more tests here and then we'll move on to the arms and back. Does this feel sharp or dull?
Dull. Dull. I can't tell.
What about now? Does this feel sharp?
I think that's sharp. Yeah.
Does this feel sharp all the way?
No, not all the way.
Tell me when you don't feel the vibration anymore.
I never felt it. I can't feel anything.
Okay. So we're gonna go ahead and check your arms and your back now. I just want to make sure that there is that the nerve damage is localized.
Yeah, something is definitely going on.
Okay. So first, go ahead and tell me if you feel it on the left or right.
Right. Left. 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 Could you do it again? I think that was the left.
Okay. Now go ahead and tell me if you feel this wet or dry.
Wet. 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 Dry. 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 Wet. Wet.
Going to go ahead and listen to your lungs from the back. Take a deep breath in for me. And exhale. And again, breathe in. And breathe out. Okay, no fluid buildup. Can you please tell me if you feel 2 pressure points or 1?
Okay. 1. 1. 1. 2. 2. 1. 2. 1. 2. 2. 2. 1. 1.
Okay, I'm going to go ahead and palpate your spine. I'm not feeling any deviation of the normal curvatures. Go ahead and tell me if you feel this on the left or right.
Left. Left. Right. Left. 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 Right. Left. Left. Right.
Go ahead and tell me if this feels sharp or dull.
Dull. Dull. I didn't feel anything. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. Dull. Dull.
Go ahead and tell me if you feel this vibration.
I feel it.
Tell me when it stops.
It stopped.
Tell me if you feel this.
Yes.
Tell me when it stops.
It stopped.
Same thing.
I feel it. It stopped.
Okay. Okay, we're going to order some more tests. I definitely want to do an MRI of the chest and the spine just to rule out anything that might be compressing the nerves.